Hello, my name is Dr. Diwan S. Raja. Today I will discuss about neural tube defects. I'll also describe the pathogenesis, causes, and the management of the Anencephaly, Enencephaly, also Spina Bifida. So we'll go through the neural tube defects. This is one of the most common congenital birth defect. Okay, we got that. So first of all, there is formation of neural tube. Then that neural tube may not close properly. That may lead to anomalies like that of Anencephaly or Enencephaly or Spina Bifida. So we'll go to the formation of neural tube first. Formation of the neural tube. Neural tube is formed from ectoderm. So it is formed from ectoderm. And its formation begins during 3rd week of intrauterine life. During 3rd week of intrauterine life. Okay, and neural tube closes during the 4th week of intrauterine life. The neural tube closes during the 4th week of intrauterine life. 4th week of intrauterine life. Okay, we got that. So we'll go through this figure. So how it happens. So during 3rd week we have 3 germ layers. So it is trilaminar germ disc. So during 3rd week we have 3 germ layers. These are the ectoderm, mesoderm, and endoderm. Okay, 3 germ layers. So this is the endoderm. This is mesoderm. This is ectoderm. Okay. Initially, the ectoderm is flat. Then it will begin to fold at the end of the 3rd week. So this red structure is the notochord. This is notochord. Okay. Notochord. This is the mesodermal tissue block. Notochord, around which the spinal cord and vertebral column is developed along the notochord and paraxial mesoderm has influence on the ectoderm, overlying ectoderm. So there will be ectodermal thickening. So notochord will induce the thickening of the ectoderm, thickening of the overlying ectoderm. Okay, so notochord will induce the ectoderm to thicken like that. So initially it is like this, then it is folded like this, then there will be neural groove formation. Here it is neural groove formation of neural groove. Okay, then there will be formation of neural tube here. This is the neural tube, and the edge of the neural folding, will be converted into neural crest. This will be converted into neural crest. Okay, so then neural crest cell will be separated. This is a neural crest cell, neural crest. This is the neural tube, okay. This is the notochord, okay. We got that, the formation of neural tube. Okay, neural tube formation during the 3rd week of development. Then what will happen? From the neural tube we will get the central nervous system. The central nervous system, the CNS, is developed from the neural tube. Okay, so the CNS is developed from the neural tube. So this is the neural tube here. Then upper 2/3 will form the brain, lower 1/3 will form the, upper 2/3 will form the brain, lower 1/3 will form the spinal cord. Okay, so the brain, the forebrain, midbrain, hindbrain. Okay, the forebrain, midbrain or mesencephalon, midbrain and hindbrain or rhombencephalon, hindbrain. These are coming from the upper 2/3 of the neural tube. The lower 1/3 will get the spinal cord. Here we will get the spinal cord. Spinal cord. Okay, and this is the anterior neuropore, posterior neuropore. Okay, so the CNS is developed from the neural tube. So the neural tube is contributing in the formation of the brain and spinal cord. CNS means brain and spinal cord. Okay, so by the thickening of the neural tube we get the cerebrum and also the brain mass, and the cavity here, the lumen of the neural tube, will give rise to the formation of ventricle of the brain, and this part will contribute in the formation of the central canal of the spinal cord, Okay, we got that. The neural tube. This is the anterior neuropore. It closes around the 25th day. Okay, closes at 25th day of intrauterine life. the posterior neuropore or caudal neuropore, posterior neuropore, it closes at 27th day. Okay, we got that. So that closure is essential. If the closing does not happen, then we get the problem Anencephaly or Enencephaly or Spina Bifida. Anencephaly in the upper two-third, Spina Bifida in the spinal cord will have the neural tube defects. This should be closed. Okay, it should be closed. Okay, then we'll get, this is the central canal of spinal cord. This is the ventricular system of the brain. Around the neural tube wall, we'll get the brain mass, forebrain, midbrain, hindbrain, the encephalon, mesencephalon, rhombencephalon. Okay, we'll get that way. The development of the first neural plate, then neural groove here, then we'll get the neural tube here, neural crest. Neural crest will contribute in the formation of the peripheral nervous system, the autonomic nervous system, as well as the skeleton of the head and neck. Even it contributes in the formation of the endocardial cushion, in the formation of the valve of the heart, also the interventricular foraminal surrounding is formed by the neural crest set. We'll not go there. We'll confine to Anencephaly, Spina Bifida. So we got the formation. Now the neuropore may not close. If the anterior neuropore does not close, if the anterior or upper neuropore does not close, we'll get Anencephaly. This is Anencephaly. Anencephaly. Okay. What happened in Anencephaly? The vault of the skull is missing. Vault of the skull is missing. Does not develop. Okay. Vault of the skull does not develop. Brain does not develop. Okay. We may give brain substance around the brain stem, midbrain, pons, medulla oblongata, but the cerebrum will not develop. Okay. Skull, bone will be missing. So the substance of the brain, remaining brain in the lower part of the brain stem will be exposed to the amniotic fluid. Okay. That is the Anencephaly. And Anencephaly baby, usually they cannot survive even if they are born alive, but they will die within few hours, maybe within few days. Most of them actually die in the intrauterine life because they will born as a stillborn baby, or if they born, they will not survive more than few hours or few days because the brain is missing here. During intrauterine life, maternal placenta support the baby, so this baby may go to the full-term pregnancy, even it may need cesarean section, C-section, because engagement is not good in this baby, but outcome is not good in Anencephaly. Okay, so we got Anencephaly. We have another problem is Enencephaly. Enencephaly. Okay, also called Encephalocele. Also called Encephalocele. What happened? The skull bone is not properly developed over the brain. and brain substance may go along the gap in the skull bone, especially the occipital bone. This is called Enencephaly or Encephalocele. Encephalocele or Enencephaly. The occipital bone, there is a gap there, brain substance will go back, okay, and this is the Encephalocele or Enencephaly, okay. Another problem, that is the Spina Bifida. Spina Bifida. Spina Bifida. What happens? We have multiple type, okay. The spine of the vertebra is missing. There is a gap here along the vertebral lamina, okay, and the spine is missing, but this is covered by the skin, and there is a tuft of hair. This is hair, tuft of hair, a patch of hair is just over the skin in the midline, usually in the lumbosacral region. This is the Spina Bifida Occulta. Okay, we must remember a tuft of hair or patch of hair. Okay, hair. Okay. Usually it is harmless, but it may be associated with anal Chiari malformation, may be associated with hydrocephalus and mental retardation, or maybe even the attention deficit hyperactivity disorder. Okay, but most cases it is harmless. We have hair, a tuft of hair here, Spina Bifida Occulta. We may have Meningocele. Okay, here meninges has been pushed backward, vertebral lamina is unconnected. There's a gap between the vertebral lamina, and meninges will go out along with the cerebrospinal fluid. It is covered by the meninges, this part. Okay, it contains the CSF, and this is the meningocele. The worst is the meningomyelocele. So it contains the nerve roots here in the lumbosacral region. These are the nerve roots. It go there in case of meningomyelocele. Just the meninges is protruded here. This is the meningocele. Here the nerve roots are protruded along with the meninges here, and the vertebral spine is completely missing along with the vertebral lamina. Part of it is missing. We are getting the meninges and the nerves here, nerve roots here. Okay, this is called meningo or myelomeningocele. Myelomeningocele. Okay, so this is the worst of all the Spina Bifida. This is sometimes it is harmless without any problem. This may also cause problem. This may be ruptured because it is very soft tissue, and it is the meninges. It contains cerebrospinal fluid. If the baby is on the bed, the back behind, that is in supine position, every chance of breakdown of this. And this may be also breakdown. Also, it contains the nerve roots here, maybe in the upper part, spinal cord itself. Here the nerve roots. So that may be worse scenario. This may be ruptured totally. Okay, so we got different type of neural tube defect. Anencephaly, Enencephaly. Okay, we have Anencephaly, Enencephaly, Cephaly, Spina Bifida Occulta, Meningocele, Myelomeningocele. Okay, we got the different type of neural tube defect. Now, what is the incidence of this neural tube defect? Incidence vary from country to country, region to region, also depends on the nutritional factor. Anencephaly, we have in the United States, almost every year we have around 850 babies. Okay, in the United States. In the USA, it varies from person to person. It vary from country to country depending on the population size and the demography. Anencephaly around 850 babies. Encephalocele, Encephalocele, okay, it would be around 1 in, okay, we have Encephalocele, we may have around 400 babies in the United States approximately. And Spina Bifida, this is more common, around 1500 babies every year will get this number of babies, the new cases of the neural tube defects. We got that. So as I mentioned, it varies from geography to geography. It is more common in North China, in Ireland, okay, among the Hispanic of the United States, Hispanic population in the USA, okay. So it then after Hispanic, the white American has more chance to get the neural tube defect. It is less in African American population. So it is more in the Hispanic, comparatively more in the white population, least in the African Americans. So Hispanic people has more chance to get neural tube defect in the United States than that of the white Americans and also the African Americans. Okay, we got that, the incidence. Now, what are the causes of neural tube defect? Causes or etiology, okay, or etiology of the neural tube defect. Number one, we should know that it is multifactorial. There will be environment has very important role. Environment, so it may be environmental, it may be nutritional, it may be genetic factor, genetics, and iatrogenic. Okay. Environmental factor, as I mentioned, it is more common in North China, Ireland. Okay. Nutritional factor, if you go to the nutrition, then we have to know that folic acid deficiency, very important cause. Okay, so for any region, folic acid deficiency, it may be less in the diet. That a lot of country in the world, they does not fortify their bread or other cereals with that of folic acid. Okay, so nutrition deficiency, folic acid deficiency is an important factor. Okay, environment is important factor. Someone is exposed to irradiation, okay, they may have babies more possibility to get neural tube defect. Someone is exposed to nuclear radiation, they may have more chance to get that of baby with spina bifida or anencephaly. Okay, that is a possibility. And we have to know that mom with maternal diabetes mellitus, maternal diabetes, it is gestational diabetes, this is uncontrolled diabetes mellitus, is an important cause of previous history of neural tube defect, previous history of neural tube defect. Okay, previous history of neural tube defect. It may, in animal study, it is found that it may be associated with hypothermia, or maybe due to hypervitaminosis A, or toxicity due to excessive vitamin A, hypervitaminosis A. Okay, so we have to know that these are the factors that may cause neural tube defect. Okay, we got environment, we got nutrition. Okay, then we have to know that it may be caused by some drug, like that of anti-epileptic drugs. Okay, anti-epileptic drug like that of the valproic acid, carbamazepine. Okay, it may be some type of anti-cancer drug, anti-folic acid drug. Okay, anti-cancer drug. Okay, example, methotrexate. Okay, it may be caused by some other medication that suppress the folic acid, some antibiotic. Okay, antibiotic like that of cotrimexazole or sulfamethoxazole trimethoprim combination, cotrimexazole. Okay, so drug may cause, or it may be due to any other chemotherapeutic drug that may lead to spina bifida, may lead to anencephaly. Okay, there may be recurrence rate if one of the sibling has anencephaly or spina bifida. Second child of that couple may have, another sibling may have more chance to get spina bifida or anencephaly. So if a couple has one baby with spina bifida or anencephaly, they have more chance to get another baby with neural tube defect. Okay, we got the causes. Now we go to the diagnosis. Diagnosis by means of we can diagnose this case. There will be high alpha fetoprotein, that is a glycoprotein that is produced by the yolk sac initially, then by the liver. The alpha fetoprotein, high alpha fetoprotein, and also high maternal serum alpha fetoprotein, maternal serum alpha fetoprotein, AFP. Okay, fetoprotein. Okay, this will be high in case of neural tube defect. Okay, so maternal serum reflect the fetal high alpha fetoprotein level. So this can be done by, you can assess that by means of amniocentesis. We can assess the high fetal alpha fetoprotein. Okay, you can say high fetal alpha fetoprotein. We can assess by means of amniocentesis. Okay, this is one way. Another way, diagnosis by ultrasonography. We can assess we can diagnose the spina bifida, anencephaly, or encephalocele, or enencephaly, same thing. Okay, these are the way of diagnosis. Okay, complication. What are the complications of neural tube defect? Complications. Okay, where it happened? Especially anencephaly complication, baby may be stillborn, may born dead, or may die after few hours. Okay, Also, outcome of Enencephaly is also bad, like that of Anencephaly, maybe little good, but still life is not compatible for longer time with Enencephaly. In Spina Bifida, complications of Spina Bifida will emphasize there. Spina Bifida, we may have a lot of complication. Okay, complication, we will have that of Spina Bifida will have motor and sensory loss to the lower limb, motor and sensory loss to the lower limb. Okay, we got that. Then we get also the incompetence of the sphincters, like the anal sphincter, the urethral sphincter. There will be incompetence of the anal sphincter. Incompetence of the anal sphincter. Of the sphincter, it may be anal or urinary sphincter, anal and urinary. You can say urethral sphincter, urethral sphincter. Okay, we get that. So there will be intellectual inability because there will be chance of hydrocephalus, and there is herniation of the brainstem through the foramen magnum. We call it also part of the cerebellar tonsil. We call it Arnold-Chiari malformation. Arnold-Chiari malformation. And we may have syringomyelia, specifically on the cervical region of the spinal cord. There may be a tube inside the cervical level of the spinal cord. Okay, and we may get club foot. Okay, so we got many problems with the neural tube defect. Okay, we got a lot. 3, 4, 5. Okay, there may have mental retardation, intellectual disability due to hydrocephalus. That is possible. Okay, complication. Now, how can we prevent it? Prevention is most important. Prevention by folic acid. Okay,